our bones are a living, breathing organ that need to be paid attention to. And that's something that a lot of people don't think about. So I'm going to ask all of our doctors today to comment on this notion that people need to know their bones. Just like you would know your cardiac health, you need to know your bone health. And what does that mean? So much of what we're trying to do is to empower you to ask your doctor about these questions about your bone health. So I'm going to toss it down to you, Paul, to start, and we'll just come down the line here and comment on that.
Yeah, Dr. Roy, I agree that patients need to know their bones. One thing you need to understand is that bone is a living organ, and it's constantly being broken down and replaced. We reach maximum bone strength in our 20s. And then once after 20s, we begin to lose bone strength approximately 1% per year until age 50 in women, when they typically are reaching menopause. And when estrogen decreases in women, they start to lose bone faster, usually about 2%. And this can lower your bone strength to the point where you are going to sustain what we call fragility fractures. In other words, a fracture with a very minimal mechanism. So understanding the physiology throughout life of bone is really important, because ideally what you'd like to do is reach maximum bone strength at the highest level possible. But you have to do that in your teenage and young adult years. Unfortunately, once that horse is out of the barn, we have a difficult time fixing it.
Right. Savage.
Yeah, I think one of the most shocking things, too, is how common this diagnosis is. I think historically people thought that this was a disease of postmenopausal women. Totally not true. I think the global prevalence right now is almost 20%, so 60 million people in the United States have a diagnosis of osteoporosis. For what we do for a living in spine surgery, it's an alarmingly high rate. The percentage of patients that come to us who have a diagnosis of osteoporosis and they don't even know about it. Some studies show that up to 50% of women over the age of 60 who have spine surgery have a diagnosis of osteoporosis. And it's also a disease of men, 30% of men over the age of 75, and up to 20% of spine surgery patients, men, have a diagnosis of osteoporosis. So I think the recognition part is something that we're really starting to kind of recognize, and how important it is to kind of get this diagnosis, to understand it, and then more importantly, to get it treated.
Right.
I think, as Dr. Anderson had described, we achieve our peak bone mass in our 20s, and usually by the late 20s and 30, we've gotten as high as we can get. And so it's critical to pay attention when you're younger, and also pay attention to your kids to make sure they're getting adequate nutrition, calcium and vitamin D, things like milk and dairy products, or if not, at least taking supplements to maximize their intake. And then also any sort of weight-bearing activity. So it's important that kids get outside and are maintain their activity. So a sedentary lifestyle, and then also in your 20s using alcohol or starting to smoke can have significant harmful effects on your bone. And that's especially important when you're still developing and increasing your bone mass, let alone afterwards when it decreases at a faster rate.